Hello everyone, myself Dr. Raminder Kaur from School of Healthcare and Paramedical Sciences. Today I am going to present on the topic mat exercises or functional re-education. First of all, I would like to tell that what is re-education. Re-education means educating something which is already known by an individual. An educational training for an activity or function which is known by the patient earlier. Here the patient knows the activities or movements that has to be performed, but due to any disease or any diseased pathology, he could not perform it properly. So the functional re-education program helps the patient to make him independent. Making the man independent is the main motto for the functional re-education program. In the functional re-education training, the sequence of progressions of the position like development of the milestone of the child from lying to walking. As soon as childbirth, it can adopt the supine position. Later, the stability will be improved. Then it will achieve the side lying. Then from side lying, it progressed to the supine. After achieving the prone position, it tries to lift its head and the trunk with the help of elbow and forearm, and thus attains the elbow prone lying. Soon after getting prone on elbow position, it still tries and gains the prone on hand position. In the prone on hand position, the child pulls its lower limb upwards and adopting the quadruped position. With this, the child crawls and starts its first mobility. Then from the quadruped, the child holds the furniture, wall or some objects and achieving the kneeling position. With it starts kneel walking with the support. After development of the stability, it attains the standing position with the help of support from the kneeling. Depends on the condition and level of his independence, the program can be designed. Depends on the condition, the sequence may be planned and multiple posture may be overlapped during that program. The sequence activities, techniques also can be varying from patient to another. Normally, the functional re-education program can be helpful mostly for the entire orthopedics, neurological and cardiac conditions. Now, what is the function of the functional re-education program? It helps to improve the coordination and balance of the patient. It will also increase the strength and endurance of the muscle. It will increase the stability of the pelvic joint. It increases the dynamic and static stability also. It will enhance the proprioception function. It improves the postural instability. It improves the ambulatory skills. Now, what consists of functional re-education training? It consists of pre-ambulatory mat exercise and ambulatory training. That will be rolling, supine to side lying, then side lying to prone to side lying to supine, elbow prone lying, then hand prone lying, then elbow side lying quadruped position, then side sitting, sitting, kneeling, kneel sitting, half kneeling, standing and walking. In each and every posture, many of the exercises can be practiced for the progression and for the which purpose? To improve the stability as well as mobility. This progressive exercise program in which position it will makes the patient master in that particular posture, and it will also gives more confidence for the next progressive posture. Now, first of all, if we talk about the supine position, now what is this? Progressive activities in supine position, that will consist of like most of the exercises which can be performed in the supine lying posture, like neck stability and strengthening exercises, upper and lower limb coordination as well as strengthening programs, then trunk exercises, then postural drainage techniques. Also in supine position, which is a very important and very convenient posture to adopt for a long period of time. All the strengthening exercises starts with assisted exercise, progressed to assisted resisted, then ends with resistance exercises. Then if we will go for bridging, now what is bridging? In the supine lying, Both the knees are flexed and feet are placed on the couch. Then patient is asked to raise his trunk from the floor or couch. The hip knee trunk aligns in the straight line. Normally, it will be considered in hemiplegic condition that is made to practice to improve the independency. Now this is the picture which I am going to show you, that is bridging with the assistance of the therapist. Then supine to side lying. Rolling can be practiced with the assistance. While rolling towards left side, below said sequences which can be performed. First of all, right hand pulls the upper body, that is upper trunk and pelvic, towards left side by holding the bed end or bedside bars in the left side. Then the right knee is flexed and with the foot, the pelvic and lower trunk pushed towards the left side. Here is the picture which is showing the rolling from supine to side lying with the assistance of the therapist. Left leg can be hooked over the bed end and rotated the lower trunk. And the left leg hand may also assist to turn the upper trunk by grasping the bed end. Now what are the uses of this posture? It is useful in bed making activities. It is useful in preventing the bed sores. It is easy to progress to next posture. Now what is the uses of side lying? Some of the exercises like upper and lower extremities strengthening exercises can be performed. Coordination exercises can also be performed. Postural drainage techniques can also be performed. Assistive movements which can be performed in the early stages. Independent activities can also be practiced. If the stability and strength is more, the patient can practice the resisted exercises. Depends on the muscle power, the stage of exercise program is selected. Now we will go for side lying to prone. Left shoulder adducted and elbow extended and placed under the body. Right hand grasping the head and bedside bars or bed end, and it will rotate the upper trunk. Left upper extremity extended throughout and right knees will be flexed and with the foot pushes the mat to rotate the lower trunk. Then what kind of progressive activities can be performed with this posture? Like neck stability exercises which can be performed. Then the spinal extensor exercises performed. Some of the upper lower extremity exercises which can be performed. It starts with the assisted exercise and ends in the resisted exercises to improve the strength of the muscles. Now what is the uses? It is also useful for the bed activities to prevent the bed sores, then useful for the postural drainage techniques, and it is also useful to perform the above said exercises. Now prone to side lying. Right hand placed sideways and the pressure applied over the mat by which upper trunk and the head can be raised up. Right knee will be flexed in this and the pressure applied on the mat to rotate the lower trunk. Left hand holds the bedside bars or the right side bars and pushes the body towards the left side. Here the total body rotates 90 degrees. Now the left hand goes down and the right hand comes up. Now side lying to supine. Right hand holds the bed end or the side bars and pulls the upper trunk towards the back side. Left lower limb hooks the bed end and pulls the lower trunk towards the front side. Left hand applies pressure over the bed or bedside bars and it will push the body backside. Now above mentioned all the rolling techniques which is done with the assistance if we talk about in the early stages, and it is progressed into the independent rolling. Now the elbow prone lying. The elbow and forearm supports patient's upper trunk and weight is transmitted through the elbow. This position is achieved from prone lying. Forearm will be in the pronation, wrist hand will be in extension and palm is flat supported by the surface. Here is the picture which is showing the prone on elbow position with the assistance of physiotherapist. Now progressive activities. This position can be adopted with the help of assistance from prone lying. Progression can be made to maintain the posture independently. Then manual approximation force can be applied towards one side to another, may improve the dynamic stability of the upper extremity. Elbow walking can be practiced. Shifting the body weight towards one side of the elbow and another side elbow can be removed from the mat and swings towards the weight bearing limb posteriorly. This may improve the proprioception activity more over the shoulder joint. The resistance can also be applied manually to improve the strength of the muscles. Now, what is the use of this posture? Bed making activities, again the dressing activities. Patient can hold the magazine and read in this position. These activities can also helpful for the paraplegic patients to improve their upper limb stability. Now, hand prone lying. This position is same like as that of the elbow prone lying. In this position, now what is the difference? The base of support will be decreased and center of gravity raised comparatively with the elbow prone lying. Here, instead of weight bearing on the elbow, the weight is transmitted through the hand and the wrist. This is intermediate position between the elbow prone lying and quadruped position. Hyperextension of spine as well as hip joint occurs more, which is useful for the postural alignment during ambulation. In beginning, this position can be achieved by the assistance of therapist. Like prone on elbow position, many of the progressive activities can also be performed with this posture. Now, what will be the position of the joints in this posture? Shoulder will be in flexion and abduction. Elbow will be in extension, wrist will be in hyperextension, fingers will be in extension and forearm will be in pronation. Then progression activities. Position may be achieved by the assistance and support which is given to maintain the posture during the early stage. Then preparing the patient to maintain the posture independently without any assistance. Weight shifting from one side to another, which can also be practiced to improve the muscle power as well as proprioception activities over the shoulder joint. Hand walking can also be practiced. Then push-up exercises may also be helpful to improve the static as well as dynamic stability of the upper limb. Then pegboards can also be used to improve the hand coordination. What is the use of this posture? This posture is helpful for the paraplegic patient to improve the upper limb muscle power and strength. It is also useful for the dressing activities. Bed mobility can be improved. Then quadruped position. It is otherwise called as four-footed position or animal position. In this position, the base of support will be decreased while comparative with the hand prone lying and center of gravity increased. It is the first position in which weight bearing through the hip joint takes place in the re-education training. It can be achieved from hand prone lying and the side sitting. Here is the picture which is showing the quadruped position from hand prone lying position with the assistance of the physiotherapist. From hand prone lying, the hip and knee is flexed and pelvis is taken up to the knee level and body is raised with the help of therapist support. Then from side sitting, the trunk is rotated and raised up. Both upper limb is placed front and allowing weight bearing on the knees and the hands. Then position, trunk will be in forward flexion, hip and knee will be in flexed 90 degrees, elbow that is in extension, wrist will also be in the extension, shoulder will be in flexion and extension, forearm will be in pronation and palm which is flat and placed on the floor. Then what kind of progressive activities? It is achieved from the prone on hand or side sitting position with the help of assistance. It will also achieve maintenance of the posture which is practiced regularly to improve the maintenance. Manual force is applied sideways and antero-posterior direction to achieve the coordination as well as stability of the upper and lower limb. Now, what is the use of this posture? It is used for the floor level activities like playing with the kids, seeding, weeding and gardening activities. It is useful for the patients who cannot walk to ambulate in and out of the house. Then is elbow side lying. This can be achieved from the sideline. In this, base of support is less and center of gravity is high while comparing with the elbow prone lying. It is very much unstable and inconvenient for an individual to maintain for the long period of time. This posture can be supported with the opposite side hand placing over the mat in front. Then position, same like the side lying, but the elbow is flexed and placed on the mat and upper trunk weight is transmitted through the weight bearing elbow. Elbow will be in flexion, shoulder will be in extension, elevation and internal rotation. Then progressive activities. This position is achieved from elbow prone lying with the help of assistance. Independently maintaining the position can also be practiced. Creeping with the help of elbow on the mat is taught to improve the dynamic as well as static stability and proprioception activities. Then manual approximation force is also applied to increase the static stability over the upper limb. Resisted activities which can also be performed to increase the muscle power. Uses: mat mobility activities, then the relaxed position for reading books and watching television also, and this is the en route for the sitting position. Then side sitting. This position can be achieved from the elbow side lying as well as from the kneel sitting. Here the base of support still reduces and center of gravity increased while comparing with the elbow side lying, and it is more stable than kneel sitting posture. Both the upper extremity will be supporting this posture. Here is the picture which is showing the side sitting position from elbow side lying with the assistance of therapist. Now from elbow side lying we can achieve the elbow side lying, hip and knee is flexed, elbow extended, palm is flat and placed on the floor and trunk raised. From kneel sitting the hip and knees are extended and one side of the hip is placed on the floor with the same side upper limb support. Then positions, hip and knees are flexed and kept in the side, weight is transmitted through one upper limb and pelvis of one side, shoulder will be in abduction and elevation, elbow is extended, lower limb is flexed, abducted and laterally rotated, upper limb is medially rotated and flexed. What kind of progressive activities? Earlier this position is adopted from elbow side lying and kneel sitting with the help of assistance from the therapist. Therapist will be in sitting side to the patient and first flexing both the hip and knees with extending the elbows. The patient is made to practice the posture without any support. Side sitting will be practiced for both sides. Then uses: floor level household activities like cutting vegetables, eating, garland making, etc. Then is the long sitting position. This is very stable position to maintain for a long period of time. This can be achieved from side sitting. The trunk muscles should have good power and strength to maintain the trunk in erect position and supported by both upper limbs by placing either side. Sometimes the upper limb may be placed posteriorly to avoid back falling. Now position: spine will be erect, shoulder will be in abduction and elevation, elbow will be in extension, wrist again in extension, hip will be in flexion and lateral rotation, knees will be in flexion, that will be 90 degrees. Then progressive activities. Posture is achieved with the help of therapist grasping the trunk and making it straight. Patient is maintained to maintain the posture with the help of upper limb support without any external support. Balancing force which can be applied in the side as well as in the anterior-posterior direction. Weight shifting from one extremity to another will be practiced to improve the proprioceptive activity over the shoulder region. Now, what is the use of this posture? Uses will be same as we did in the quadruped position. Now, next is kneeling. Standing on both knees, which is called kneeling. This can be achieved from quadruped position and side sitting. In this posture, BUS will be decreased and center of gravity will be raised. This is very much inconvenient posture to maintain for a long period of time. Stability in this posture is also very less. Here is the picture which is showing the kneel sitting from side sitting posture with the assistance of therapist. Then from quadruped position, therapist standing back of the patient, grasping the upper trunk and lifting the trunk and upper extremity up. The posture is maintained with the help of back support by the therapist. Then from side sitting, same like for the quadruped position, the therapist grasping the upper trunk by standing back to the patient and lifting him. Progressive activities, patient is assisted to maintain the posture in the beginning stage. Independent maintaining the posture which can be practiced. Manual approximation force is applied. Then hip hiking can be practiced in this posture also. Mat crutch activities can also be practiced. Lifting the body by holding the furniture or wall, which is also done. Now what are the uses? For the dressing activities, useful for the mobility, useful to play with the kids, improves the floor level activities. Then is the half kneeling. It is achieved from kneeling. To achieve from the kneeling, weight is transmitted to one side, one knee, and opposite lower extremity is lifted and hip is flexed and foot is placed front on the mat. In this posture, the base of support is more and center of gravity is less, and it is the intermediate posture between the kneeling and standing. Now weight bearing, over one side knee, another side hip and knees are flexed and foot is kept on the floor. Here is the picture which is showing the half kneeling with the support of therapist. Then progressive activities, assisted balancing approximation force weight shifting activities which can be performed. Then push-ups can also be practiced to come out of this posture and go for the standing posture with the help of furniture or the wall. Then standing. Here the base of support is less and center of gravity is increased. So this is the unstable posture to maintain for a prolonged period of time, and this is also the intermediate position between half kneeling and the walking. It can also be achieved from half kneeling and long sitting, and this is the starting position for the walking. Therapist is standing back to the patient and grasping the upper trunk with both the hands and lifting the patient up. The kneeling, legs move forwards and foot on the mat or the floor. Otherwise, patient can hold the furniture or the wall and lift his body up to reach the standing with the help of assistance. Then from sitting, the therapist has to sit in the front of patient on the stool and has to lock the patient's knee with his knees while he is made to stand. The therapist has to hold the pelvis of the patient and lift him, the patient by holding the shoulder region of the therapist to avoid falling. Here is the picture which is showing the standing position from sitting with the assistance of therapist. Then progressive activities. Beginning, the patient is made to stand in the corner of the wall with the therapist support in front so that the patient cannot fall front, back and sideways. Independent, maintaining the standing posture which can also be improved to perform the static stability. Approximation force is also applied in front, back and lateral direction to improve the lateral stability. Then the parallel bar walking. As soon as the motor control is achieved in the standing posture, the parallel bar activities which can be introduced. Before going for these activities, the parallel bar should be adjusted depends on the patient's height. Normally, the height of the parallel bar should be up to the level of the greater trochanter of the femur. Now, what kind of general instructions which is performed? Proper instructions should be given throughout the walking training. It includes walking pattern, progressive activities, turning techniques, stability, balance and coordination. Generally, the verbal command improves or facilitates the activities more. The support or assistance of the therapist will be given in the weaker side limb to increase more stability. In some conditions like unstable knee, and the therapist should lock the knee of the patient and body weight is transmitted through the locked knee joint. Now, what kind of progressive activities performed? During the initial range of the parallel bar activities, the therapist should give support to the patient from falling. Normally, the therapist has to stand towards the weaker side to give the stability. During the initial standing, the therapist should be careful about the complaints of the lightheadedness, nausea due to the postural hypotension. The patient can be practiced below mentioned progressive exercises to improve the conditions. Patient is made to stand with the support of parallel bar without therapist support in early stages, then shifting from weight lateral, anterior, posterior sides without altering the hand position in the parallel bar. Patient is recommended to stand with one leg support and transmitting whole weight over the supported leg. Then for example, while turning towards right side, right leg is raised and placed on the floor 90 degrees to the previous posture, and same was followed by the left foot and kept parallel to the right foot, which is next to that of the left hand is removed from the left side and placed, and on the right side parallel bar to attain the perfect support. The therapist may also help the patient supporting him by standing back to him. So this is all for the mat exercises. Thank you so much.